As a leader, Art believes that we are stewards of this asset that we have been gifted to take care of, and he shares that vision with all of us. And he does that not simply by speaking about it, but he does what I call walk the talk. He is boots on the ground. He is rounding amongst all of our departments and all of our centers.
He understands the difference between management and leadership. Management is telling people where to go, and leadership is setting a vision and having everyone buy into the vision.
He trusted his staff, and we trusted him.
He's been an advocate interacting with many of state legislators on many policies that affect not only MDI, but many other hospitals, particularly rural hospitals. If there's one thing you can say about Art, it is his passion to support and be an advocate for the underdog.
Art's got compassion. I mean, he cares about people, whether they're the patients, the community, the employees of the organization, medical staff, nurses. I think he's a compassionate guy, and that's really is, I think, the number one thing that it takes to be a healthcare person.
Well, as a friend, there have been some favors that Art has done for me to support me and help me out when my wife became seriously ill. And I will always appreciate that. He has been a great friend in that regard and a great person to work with.
I think the greatest thing that stands out for me, if I sat and thought about it, which I did last night, is his ability to imbue his professional life with his personal morality. And so his ethics and morals move into his professional life, and he does the right thing as much as he can in his professional life based on the ethics and morality.
When I first got to know Art, may I please tell you this story that it was quite comical, because I would call up his office and the secretary would answer the phone and say, Art Blank's office? And I'd say, yes, this is Debbie calling. I'd get right in with no problem at all. It was quite a while later that I found the reason is because his wife's name is Debbie. And so needless to say, I got right in.
The thing that's left the biggest impression with me over the years, if we were talking to a healthcare provider, is he has never failed when I bring him a problem. If it's patient-focused, the first thing he'll ask is, Ruth, how is the patient? That's what's important, is how is the patient.
I'm so grateful that I was able to work with a CEO who's so compassionate for our community, but also for our hospital as a whole, and especially to our patients.
In surgery, you're said that you need three things to be successful. You need to be available, affable, and able. And I'm going to say that I really like that. I've seen all of those qualities in Art.
The way he shares his experience and knowledge of healthcare and working in leadership, you can't get that from a book, and you can't get that from a class. You really have to develop that depth of knowledge, and Art eagerly shares that with people.
Well, what I enjoyed most, honestly, is just the fact that he brought the community feeling to this hospital.
His door is always open. Any employee feels comfortable to go and talk to them about any concerns that they're having.
So in the morning, I was passing Art in the hallway, and I said, "Good morning, Mr. Blank." And he looked at me and he said, "Jennifer, you can call me Art." And I thought in my mind, well, I would if I could, but I am a native Mainer, and I'm not sure I could buy an hour if I was on the Wheel of Fortune and had $20,000 back. Because it comes out Art, you know what I mean? It's like, good morning, Art.
And the other thing is the time that he puts in to my organization, the YMCA. I mean, he's very unselfish. He's very concerned about the community and sees how the different organizations contribute to the way of life here in Bar Harbor. And it would be quite different if we didn't have that, and he understands that, recognizes it, and he's willing to put in the time to make sure that these organizations continue to be here and continue to contribute in such a positive way.
And now during the coronavirus outbreak, we have not only led our local community, but even the Down East region and the state in providing care, education, and organization to battle this plague. And a lot of that really rests at Art's leadership in keeping us independent and Art's leadership through this crisis.
Art has gone way above and beyond what would be called on to help COA kind of navigate this very, very challenging time. And it's one reason I think both the college and the MDI community as a whole has been so far, knock on wood, successful in navigating the challenges of the COVID pandemic. And Art's sense of thoughtfulness, strategy, humility, understanding, and smarts is partially what's gotten us in this position.
To me, the pandemic really put Art's leadership on full display. It's during these times of uncertainty when real leaders step up, and that's exactly what Art did. Over the past several months, MDI Hospital has been far and away ahead of the rest of the state of Maine. And it's truly a testament to their foresight, to their preparation, and to the great team that they have assembled.
When COVID hit, you could have furloughed many employees, and you not only didn't furlough them, you adjusted people's daycares, worked with the community, worked with HR to get people's earned time situations squared, and everyone really appreciates that we all had jobs.
One of his strengths is being a mentor and seeing that someone has the potential to to grow in the position or move up.
Oh, I enjoy everything about working with Art. He is full of energy and passion and dedication and humor. He's so approachable, and I always know his heart is in the right place. He's so open-minded, not afraid to take on the next challenge, really always thinking ahead about how to best serve our community members, how to make the next improvement for care in our region, how to tackle the next big issue, whether it's a federal policy challenge or a new health crisis in our region. It's inspiring and heartwarming always to work with Art, and I cherish every bit of it.
You have been a quiet voice, a voice of reason. Your thoughtful comments are always appreciated and listened to. The work that you have done, the friendships you've made, will last forever, and those are things that you should be very proud of.
It is important that we recognize what he does is out of true sense of self and purpose, and it is that compassion that carries over into all that he does. And that's the one thing that I know. And from that, it stems this rooted advocacy. He is an advocate. He advocates for the hospital. He advocates for other team members. He advocates for our patients and their families. And that is truly what resonates with me over working with Art all of these years. It has been a pleasure to have him remind us all that the patient is at the center of everything we do and all of our considerations.
What I'm going to do at first, if I can, is to make sure that we're at least on the same page of who Art Blank really is. And what I mean by that is I've found out new things over the years that I think would be of help to you as well. and you may already know them, but I'll just make sure, and then I'll return and talk about a few other things. But mainly what I'm talking about is Art's sense of style, and really his kind of larger than life presence when it comes to clothing and just his kind of debonair personality. I mean, I almost have no words for this picture. I mean, first of all, how about the chest, first of all, the necklace. I mean, it looks like, might even be tiger or leopard shirt underneath that amazing suit. That's what it looks like to me. I can't prove it, but this is a man full of confidence. I mean, look at the look. It's like, hey, let me just say this seriously about Arthur. This, for me, all comes from the heart. I mean that. I have been a big fan of Art Blank for years, and I think he knows that. I love him as much as anybody.
When Art announced his retirement early this year, he credited the great team that serves this region with compassion and professionalism. Nothing better describes Art's effective leadership than his appreciation for the contributions of others. This commitment to teamwork has produced remarkable results.
I'd summarize Art's legacy as an enduring commitment to the community and our organization's independence.
When I came here 15 years ago, it was very clear to many people, including me, that really the only path forward that we could see was to ally ourselves with Eastern Maine Medical Center. Art saw a different path forward. I mean, he looked at that question very hard, but has been able to lead us in an independent path where we have been able to remain a viable source not only of healthcare but health leadership for our community.
In regards to Art's legacy and where he leaves this facility, for me, part of his legacy will be his integrated care philosophy.
I think when people look back at Art's legacy for the hospital, I think it's going to be the way in which he's negotiated all these challenges. The challenges of running a small rural hospital in an environment that makes that very challenging. And the way that he's chosen sort of a path to lead us through those challenges that has been a collaborative path.
Under his direction, we became a patient-centered medical home, both in the clinics and the hospital. The Community Health Center in Southwest Harbor was built. The Trenton Health Center was built. Lisa Stewart Women's Health Center.
Also wanted to thank you for the many supports you gave us over the years for developing our behavioral health telemedicine program, both inside the hospital system and also in conjunction with the Maine Seacoast Mission and the Sunbeam boat as it went to the outer islands.
Birch Bay Village, Art always had a vision for that particular project, and sure enough, it is now a huge success and serves so many people, both in their time of need as well as in their golden years, where they've enjoyed the latter part of their life there.
Oh, gee, there's so many projects he's led that have had major impacts, but I think probably the biggest one is his work with substance use disorder and the center that we established along with Healthy Acadia in Ellsworth. That has affected the lives of many people, got many people onto the path to recovery.
So he's done a lot, and he will be missed. The nice thing about what he's done is he's left a very good team.
Any transition is significant, and it's easy but in fact true to say that I think the way you judge the legacy is by how seamlessly it goes. And it's been my experience working with Chrissy, his successor, over the past few months, that in fact the hospital is on a good footing and in good hands. So I can only judge that as a testament again to the legacy, if you will, that Art is leaving this community.
So Art leaves behind so many wonderful things, and his legacy will live on. It will live on in those seeds that he has planted, that he has cared for in all of us through our strategic plan, through our innovation, but through our integrated care, as well as through the medical education that he has laid a firm framework and infrastructure that will continue to define us as a flagship hospital for rural health. The one legacy that he leaves behind is his passion for taking care of the rural populations, and that will live on through everything that we do in the future.
So Art, you've worked real hard over the years, and you've had few bumps along the road, both professional and personal, but I think that you're in a good position now to enjoy your retirement, and I know both you and Debbie are looking forward to this time in the future to enjoy travel, enjoy taking care of the horses, enjoying your family. So I and my wife Mary wish you well and good health in your retirement, and enjoy the future.
I want to thank you for the time that we worked together, for all your support, and hopefully I supported you in the way you needed. And I just wish you a long and happy and healthy retirement.
Art, it's been a pleasure working for you for the last 3 years. I have truly enjoyed working under your leadership. I hope that you and Debbie get to have endless amounts of family time, and that soon you'll be riding on a new horse.
I just want to congratulate you on your retirement and thank you for all the support and knowledge that you've allowed me to sponge off of you. If you're ever in need of a cottage, I have one up the hill.
I'm not a mushy guy, you know that, but from the bottom of my heart, I wanted to thank you. You've been a great leader, a great person. You've helped me, you've helped my family, you've helped this community. I mean, I hope that you feel that way. I hope that you understand that you have an everlasting legacy here. I gotta say thank you. Thank you from me and my entire family.
Art, good luck on your retirement. And I tell you sincerely, thank you for all you've done for our community, our hospital, and frankly for me also.
Art, thank you. Thank you for respecting me all these years. It's been a long time. Thank you for always showing me respect and kindness and fairness. Thank you for having confidence in me when I didn't have it in myself. Art, thank you for sharing our grief journey with us when our boy went to heaven. Thank you for that. I wish all the happiness and joy and love and every good thing that life has to offer to you and to Deb and to all of your loved ones, your kids and your grandkids. Thank you, Art. Thank you so much.
Hi, Art. The OB department would like to thank you for all your years of hard work and dedication to our team.
Today, we celebrate you as we raise our famous postpartum milkshake glasses in your honor. Cheers to you.
I would just like to say thank you for your commitment, your doggedness, your accountability, and your kind heart. And finally, as a nurse, a very big thank you for being a nurse advocate and realizing the importance the role of nursing has in today's healthcare. Thank you, Art.
So Art, I really want to thank you for all the leadership and help you've provided the hospital and to me over the last 14 years for me, more than that for the institution. You were really there for me on my bad days. You helped me have the confidence to keep moving forward when I didn't see a good path. And I guess one of the final things is in how you've been able to transition to our new leadership. The incredible crisis we're facing now with coronavirus, the ability of you and Chrissy together to lead us during this transition has been wonderful. It's institution in the good way over ego. But I hope you don't think that come January you're off the hook, because I'm counting on you to be with us in general and me in particular over the next couple years as we finish muddling through this.
Well, Art, you've earned it. And I remember you telling me one time you wish you could wear your shorts more often. Well, now's your chance. Put on the dungarees, roll up your sleeves, and just enjoy it. And thank you.
Thank you, Art. It's been a tremendous privilege to work with you for these years. I am quite confident, and I hope you understand and believe me as well, to say that the state is a better place for the advice that you were countless times were provided to me and my colleagues on the Appropriations Committee. So it's with real gratitude that I would just want to thank you for our friendship.
Hey, Art, congratulations on your career. You've made such a positive difference to people, and I believe everywhere probably that you've ever been and worked and served. And speaking on behalf of myself and the YMCA, we really appreciate all that you have done.
I want to congratulate you on what I think is a really large and sustained success that that you've achieved through your vision, guiding this organization forward to what I think is a very successful way.
What can I say to you, Art? It has been a privilege for me to work with you and to observe your leadership of the hospital. And I sincerely mean not only a privilege, but it's been an experience that I treasure. And I want to thank you for all the support you've given me all these years. And I wish you a good retirement.
Art, I really want to wish you warm wishes and congratulations on your retirement. The community will miss you, the hospital will miss you, and you're one of those folks that may not be out in front of the camera every day, but make a big difference in the lives of the people of this community.
Art, I want to congratulate you on a very successful career and a well-deserved retirement. You are a true example of a great CEO who cared so much and had so much passion for his employees and the community at large. We will miss your smile and contagious laugh. Best to you, and we will miss you.
The best testimony to your effectiveness in your administrative role was that you have lasted here over 20 years. And they've been a wonderful 20 years with lots of growth in many areas, especially the one near and dear to my heart of behavioral health. So thank you for all that work, Art.
Well, I want to wish you well in your next ventures. You've certainly helped make my last 20 years a pleasure, and a lot has to do with your hard work and dedication. And I appreciate what you've done, and thanks very much for the time and energy you've spent here.
Art, you've earned your retirement. I hope you enjoy it. The same drive and energy that leads a person through their business life doesn't die when they become retired. It just changes direction. After a little bit of time off to recoup and think about what you want to do in that next phase, you'll be busy doing something. And my advice is to pick something that you're totally committed to and not something to get dragged into. And I'm sure both of you will enjoy your retirement, and you earned it. And we hopefully will remain friends as long as we're here to do it.
I know from personal experience that busy people who retire become busier than ever, turning their attention to interesting new activities and sharing the wisdom they've gained over the years. I expect you'll have a wonderful time. I truly wish you the best. You deserve it. Thank you, Art, for everything you are and everything you do.
Art, you have been such an incredible mentor, leader, inspiration, colleague, partner, and friend over the last decade and more. I've learned so much from you. We've had such incredible opportunities to work together to build healthier communities, to support the health needs of our region, and to support the hospital. It's really been a privilege to support you in my limited way, and to really support the hospital as the hospital has flourished and has provided such incredible care to our patients and such incredible supports to our whole community. It is so sad to lose you in this role, but I'm just thrilled for what's coming next, and really looking forward to working and partnering with you in different ways to come. Thank you, Art, so much for your leadership and guidance over the years.
Art, congratulations on your retirement. Nobody deserves this more than you, and I hope that 2021 brings you lots of time to spend watching hockey, hopefully buying a horse, seeing your grandkids and family, and maybe getting to spend some actual time at your camp. So I wish you all the best, and I have your cell phone number, so I'll be reaching out when I need to talk to somebody.
Art, we've known each other for 9 years. You've been such an inspiration to me professionally, someone I could always come to, throw around ideas, questions, concerns, and I'm going to miss you an awful lot, and hopefully we can see each other again on some other beautiful sailboat and get to experience the waters and island of MDI in your happy retirement. Thanks for everything.
So Art, I wish you well in retirement. I am proud of all that you've accomplished here on the island and for the hospital and for patients and for your staff and for the community as a whole. I wish you the best, you and your family. I hope you find time to relax, wind down, do some yard work, keep that smile on your face. It's always been one that everyone's appreciated. So good luck to you, Art.
You've meant the world to me, and I just appreciate everything you've done. Congratulations on an amazing career. Congratulations on putting that community up there first, and you've always done that. And again, thank you for everything you did for all hospitals, in particular rural, but all hospitals in your role with both associations. You mean the world to me, and I mean it. I wish you the very best, but I'm going to miss you more than you'll ever know.
Art, I regard it as it to have been a privilege and a pleasure to work with you all these years. You were a wonderful leader, a loyal friend, and a thoroughly reliable leader of our hospital team. I wish you well in retirement. It can be challenging. I can tell you that as I am completing my 3rd year of retirement. I wish you you and your family, all the good fortune in the world.
I just wanted to congratulate you on your retirement and for the lifetime of work that you've done at MDI Hospital and for the community of Mount Desert Island. You are an inspiration to me, a man of selfless intentions and altruism and you will certainly not be forgotten. We all appreciate what you've done for us, whether it's on a professional level or on a personal level as a community member.
Art, your retirement is certainly well deserved, and the high quality health care available on MDI is your legacy. Thank you so much for your service, and best wishes to you and Debbie in the years to come.
Art, I guess I'd like to say, I hate to see you go. I do hate to see you go. I've really enjoyed working with you, and as an administrator, but as a friend. That's somebody that can count on, somebody that I've been able to confide in, somebody I know has my best interest, the hospital's best interest, and the community's best interest at heart. And I just hope we still get to see you here, and that your talents and skills aren't lost to the community and the hospital, and that you'll still have some sort of role. I would love to see that.
I just want to thank you for everything you've done for the hospital and the community as a colleague. And I just wish you all the happiness that you deserve with your wife, your grandchildren, your children. You deserve it, and I hope it's a wonderful retirement.
So Art, I want to wish you all the best on your encore as you now move into taking time for yourself, which is so well deserved. After 20 years of commitment to this organization and your commitment to my professional growth, as well as to this organization, I have so appreciated the time we have worked together, that we have built a framework of innovation, of community, and a sense of purpose for this organization as well. You will be missed every day, but we hope in every way that we represent all that you have done, and that we move your legacy forward into the future. And I personally thank you for what you have done for me and for this greater community, because the endless hours and dedication that you have spent have not gone unnoticed, and will be forever appreciated, and will be so very difficult to follow. But thank you.